In this video, we'll uncover the 10 hidden signs of gluten intolerance that many people overlook. Gluten intolerance affects more people than you might think, and it can cause a wide variety of symptoms that aren't always linked directly to digestion. Could gluten be silently affecting your health? Let's find out. Sign number 1. Digestive problems. One of the most obvious and telling signs of gluten intolerance is persistent digestive discomfort. If your body struggles to absorb nutrients due to gluten, it can result in symptoms like bloating, diarrhea, constipation, and gas. But why does this happen? When gluten triggers an inflammatory response in your intestines, it can damage the intestinal lining, specifically the villi, which are responsible for nutrient absorption. Studies have shown that individuals with celiac disease or non-celiac gluten sensitivity often suffer from nutrient malabsorption, which can lead to further health complications. Interestingly, some research indicates that even those without a formal diagnosis of celiac disease can experience gastrointestinal issues from gluten consumption. This means that you could have gluten sensitivity without realizing it. Sign number 2, diarrhea or constipation. While diarrhea is a hallmark symptom of celiac disease, many people with gluten intolerance experience alternating bouts of diarrhea and constipation. A study published in Gastroenterology found that chronic diarrhea is one of the most common symptoms of gluten sensitivity, but constipation can be just as prevalent, depending on how much damage has occurred in the intestines. For people with undiagnosed celiac disease, these symptoms can become so routine that they think it's just a part of daily life. But don't ignore these signs. Chronic digestive issues can lead to long-term damage, including a weakened immune system and persistent fatigue. Sign number 3, lactose intolerance. Lactose intolerance can often coexist with gluten intolerance. The reason? When the intestines are damaged by gluten, it impairs the production of lactase, the enzyme responsible for breaking down lactose. Studies show that up to 85% of people with celiac disease also experience lactose intolerance. This double hit to the digestive system makes managing your diet even more important. What's interesting is that many people don't realize that their lactose intolerance could be a side effect of gluten damage. Eliminating gluten might reduce your sensitivity to lactose, allowing you to reintroduce dairy products later on. Sign number 4, abdominal bloating. Abdominal bloating is another telltale sign of gluten intolerance. When gluten is ingested, it can lead to excessive water retention and gas production in the intestines. According to research from the American Journal of Gastroenterology, gluten can cause the immune system to mistakenly attack the digestive tract, leading to bloating and discomfort. This process occurs as the body tries to break down the complex proteins in gluten, leading to fermentation in the gut, which then produces gas. For many, the bloating is so significant that it creates visible swelling of the abdomen, which is sometimes referred to as gluten belly. Sign number 5, stress and anxiety. Did you know that gluten can also affect your mental health? Many people with gluten intolerance report feeling heightened levels of stress and anxiety, and there's a biological reason for that. Gluten has been shown to affect the brain-gut connection, meaning that the inflammation caused in the digestive tract can have a direct impact on your mood. A 2020 study published in Psychiatry Research found that individuals with gluten sensitivity had higher rates of anxiety and depression compared to those who were not sensitive to gluten. It's fascinating to see how what we eat can affect not just our physical health, but our mental well-being as well. Sign number 6, anemia. One of the more serious consequences of gluten intolerance is the risk of developing iron deficiency anemia. Gluten intolerance damages the part of the small intestine responsible for iron absorption. As a result, even if you're eating enough iron-rich foods, your body may not be absorbing them properly. Studies show that iron deficiency anemia is often one of the first signs of celiac disease. If left untreated, anemia can lead to chronic fatigue, pale skin, shortness of breath, and even heart problems. This is why it's important to test for gluten intolerance if you're experiencing persistent anemia that doesn't respond to iron supplements. Sign number 7, fatigue. Feeling tired all the time, even after a full night's sleep? Gluten might be the culprit. Research suggests that chronic fatigue is a common symptom of gluten intolerance, caused by inflammation and nutrient malabsorption. When your body doesn't get the nutrients it needs, it has to work harder, leaving you feeling exhausted. Many people with gluten intolerance report that they feel sluggish and fatigued after consuming gluten-containing foods like bread, pasta, and pastries. If this sounds familiar, it might be worth investigating whether gluten is playing a role in your energy levels. Sign number 8, bone degeneration. Gluten intolerance can significantly affect your bone health. Due to the impaired absorption of nutrients like calcium and vitamin D, individuals with gluten sensitivity may be at an increased risk of osteoporosis or osteopenia, conditions that lead to weakened bones. Research published in the Journal of Clinical Endocrinology and Metabolism found that untreated celiac disease is strongly associated with low bone density. What's even more interesting is that this bone loss can occur even in younger individuals, not just older adults, making it a critical issue to address early. Sign number 9, numbness in extremities. Experiencing numbness or tingling in your hands and feet could be linked to gluten intolerance. This symptom, known as peripheral neuropathy, has been reported in both people with celiac disease and those with non-celiac gluten sensitivity. It's a less common yet alarming sign that your body is reacting negatively to gluten. The exact mechanism isn't fully understood, but researchers believe that the inflammation triggered by gluten could be damaging the nerves, leading to sensations of numbness and tingling. Sign number 10, dental problems. Finally, gluten intolerance can affect your dental health. People with celiac disease are more likely to experience tooth enamel erosion and frequent cavities due to chronic inflammation and poor nutrient absorption. The Journal of Oral Pathology and Medicine highlights that dental enamel defects are common in individuals with gluten sensitivity, particularly in younger patients. This may be the body's way of signaling that something deeper is wrong. If you've been struggling with unexplained dental issues, it might be worth considering gluten as a possible cause. If you've noticed any of these symptoms in yourself, it's crucial to consult with a healthcare provider to explore whether gluten intolerance might be affecting your health. By identifying and eliminating gluten from your diet, you could alleviate a wide range of symptoms and improve your overall well-being. Enjoyed this video? Don't forget to give it a thumbs up and subscribe for more eye-opening health tips. Stay tuned for our next video.